Okay, I'm Callie Hunter, and I'm going to be demonstrating the proper IM injection for ventrogluteal site. Okay, so the first thing we're going to do is draw up our medication. This we would draw up inside our medication room. I have already checked my 6 rights of med administration with my MAR to verify that I do have the correct patient and correct medication. We are going to be administering 1 gram of Rocephin. So the first thing I'm going to go ahead and do is alcohol swab the top of my port. I'm going to go ahead and draw back my air. I'm going to go ahead and inject my air and draw up my medication, ensuring that I don't have bubbles. Okay, I'm going to go ahead and use the scoop method. Okay, to put my needle back on. At this point, I'm going to go ahead and switch my needles to a 22 gauge 1.5 inch needle. This is sufficient for a ventrogluteal site. Of course, this would vary some depending on your patient's size and weight. For this particular patient, a 1.5 inch will be sufficient. So I'm going to go ahead and dispose of this in my sharps container. Okay, I've got my medication. I've got my Band-Aid and my cotton ball, and I'm going to go ahead and enter the patient's room at this point, and I've got my alcohol swabs. Okay, so knock knock. Hi Jane, this is Jane Doe. Can you go ahead and tell me your name and date of birth? Okay, Jane. Your doctor has ordered us to give an IM injection of Rocephin today. So what I'm going to want you to do, I want to give this into your hip area. So if you could go ahead and position yourself on your left side. Since I am right-handed, it makes it the best way to go ahead and give this IM injection. So I'm going to go ahead and position you on your left side. Okay, next thing I'm going to do is go ahead and put my gloves on at this point. And it does kind of help some too if the patient can kind of flex their leg up a little bit. It'll help you find your landmarks a little bit easier. Okay, next I'm going to go ahead and open my Band-Aid so that it's ready. Okay, and open my alcohol here. Okay, and loosen the cap on my needle. Okay, so the next thing I want to do is go ahead and find my landmarks. So what I want to do is go ahead and put the base of my palm on the greater trochanter, kind of where that hip bone sticks out a little bit. Your thumb is going to point towards the groin area. Your index finger is going to point towards the anterior superior iliac spine. And your other fingers, your middle finger is going to go across the iliac crest. You want to spread that dorsally, move your fingers towards the buttocks region, and I'm going to go right in the middle between my middle finger and my index finger. So next I'm going to go ahead and alcohol swab my area. Again, I'm moving from inner to outer in a circular fashion. Okay, I'm going to go ahead and use my alcohol swab to kind of mark my area here. And that way I know where I'm going to go, what side I'm going to go into. So I can go ahead and release that at this point. I'm going to go ahead and get my needle. You want to hold it like a dart. I want to do the Z-track method with this specific site. So what I'm going to do is use the ulnar side of my palm here and pull the skin to the side. I want to go ahead and tell my patient that they're going to feel a stick. Okay, so 1, 2, 3, you're going to dart it in at 90 degrees. 1, 2, 3. Okay, I'm still holding my Z-track method at this point. I'm going to aspirate. There's no blood return at this point, so I'm going to go ahead and inject slowly. Again, I'm still holding that Z-track method. I'm going to pull my needle straight out. I'm going to safety lock. Go ahead and release my Z-track at this point. You really should not get a lot of blood return, however you may get a little blood, so I'm going to go ahead and put my cotton ball on. I'm going to go ahead and put my Band-Aid on at this point. I'm going to check on Chain and make sure she's tolerating this okay. And then I'm going to clean up my area and again dispose of my used needle in my sharps container. Reposition Jane back onto her back side again. And that completes the ventrogluteal injection.